My name is Dr. Allison Nelson. I work for Moreland OB-GYN. We're here today to answer some questions that we've been getting from our patients regarding COVID-19. So we've gotten a lot of questions about COVID exposure. When we break down COVID exposure, there's really two types. One, firsthand exposure, meaning you came into contact with someone who is suspected of having or has tested positive for COVID. Then there's secondhand exposure, and that's really where we're seeing patients say, well, a family member of mine worked with somebody who tested positive or had exposure. So let's start off with that secondhand exposure risk because that's sort of the easiest to deal with. If your family member or someone in your household has been exposed to someone who tested positive for COVID, as long as your family member is not showing symptoms at this time, it's still fine to go about sort of your daily activities. Again, wearing masks and socially distancing when possible. So firsthand exposure is you have had close contact, which is defined as within 6 feet of a person who is positive for COVID for greater than 15 minutes without any mask wearing. That firsthand exposure requires a different type of approach. So from that standpoint, we're going to ask that those people self-quarantine and get tested within 5 to 7 days of their last exposure with that COVID positive person. So we've also got a lot of questions about COVID-19 antibody testing. Antibodies are formed when our body comes into contact with a virus, and an antibody test allows us to see if those antibodies are present. As of right now, we don't actually know how long somebody's antibody testing stays positive after they come into contact with COVID-19. So we are really holding back on ordering and offering that antibody testing because the information that it provides is so controversial right now that we just don't know what to do with that information. So the importance of wearing a mask is twofold. It helps protect you from those around you, but also it helps to prevent the spread of COVID-19 should you be asymptomatic to the people that are around you. So we've gotten a lot of questions on what symptoms to watch for when it comes to COVID-19. The most common symptoms would be a fever, anything over 100.4, shortness of breath, or a cough. Some of the lesser common symptoms would be diarrhea, nausea, and vomiting, which we would also recommend watching out for as well. So many patients have wondered, what do I do when I bring my new baby into a COVID-19 world? So finally, let's talk about what you can do to keep your baby safe. In terms of the hospital, we still are limiting visitors. You're allowed one healthy support person through labor and through your postpartum course. I don't envision that changing, so that's certainly something that should be a part of your labor and delivery plans. In terms of when you take your baby home, we're certainly not advocating for babies to not meet their grandparents, meet their families, but in terms of what I'm recommending to my patients, everyone who sees the baby should be wearing a mask. Obviously, everyone should be healthy and free of symptoms, and everyone should be socially distant when possible. We've also had questions about breastfeeding your baby. Certainly, breastfeeding is still perfectly safe and in many times preferable, even in a COVID-19 world. In terms of how to keep your baby safe during that time, there's nothing special to do unless you yourself have tested positive for COVID, in which case you'll have a very in-depth conversation with your physician about what best to do in terms of breastfeeding your baby. That will most likely involve wearing a mask while you're breastfeeding your baby, but that would be a conversation that would be had at that time. So hopefully we were able to answer some of the most common questions that our patients have regarding COVID-19 today. Obviously, things are always changing, and as those things change, we will get you the most up-to-date information that we have. If any questions ever come up, we obviously encourage you to either call us at Moreland OB-GYN or bring up your questions with your doctor. In the meantime, wear a mask, stay socially distant when you can, Stay safe and healthy.